August is Breastfeeding Awareness Month, a time of the year dedicated to highlight why protecting, promoting, and supporting lactation is important for families. Mary Thayer joins us in studio with the story. Good morning, Mary.
Hi, Mary. Yes, this month is the time to raise awareness on how providing safe human milk to babies in need could save their life. I stopped by SSM DePaul Hospital to hear the story of one mother giving back to babies across the St. Louis region. Take a look.
You know, I feel like a hero when I do it.
Marlene Holt is a milk donor for SSM Health.
I was pumping and I was filling up the deep freeze, and then one day I was like, there's just so much milk here, I did not know what to do. And my mother-in-law, she is a retired SSM Cardinal Glennon nurse, and she would get pulled from the oncology to the NICU, and she told me that they had donor milk, and I didn't even know that was a thing. And I was like, okay, I'll try to donate my milk.
It's proven that those first days of babies' lives can dramatically improve with the support of human breast milk, which is why, in partnership with the Milk Bank, SSM Health in St. Louis announces it will now provide life-saving pasteurized donated human breast milk for babies in need at each of the health system's St. Louis family birthplace centers.
We're excited to share with our community that we're kind of the first hospital system in the region that we've both expanded our donor milk use within our facilities, and we are expanding it to all of our SSM Health hospitals that deliver babies.
Dr. Catherine Hansen is a neonatologist at SSM.
Previously, donor milk was reserved for kind of the most critically ill small babies that were in the NICU, which is the specialty that I take care of. But it has been kind of proven that using donor milk as a supplement can actually improve breastfeeding outcomes for all women.
There are a lot of different reasons why a newborn, when they're in their first hospitalization after being born, may need more than just direct breastfeeding from mom.
Maybe mom doesn't have the supply, or maybe mom's going to a surgery, or a lot of other different medical complications where you might, just direct breastfeeding's not enough.
It is a mission that hits close to home for Marlene.
I definitely understand what it feels like not being able to breastfeed, because when my daughter was born, she had to be on formula. My milk didn't come in, and it was really hard for me. But thankfully, she did decide to latch finally after probably the 3rd month, right before I had to go back to work.
And now she is a hero, helping other families by donating this life-saving, critical resource.
Ultimately, every woman that I've spoken to that has been able to donate milk speaks about what a rewarding experience it is for them in the end, that they were, maybe thought it was hard, but the Milk Bank and our lactation support at Cardinal Glennon, and all of our lactation support in SSM, really try to make it as easy as possible to help you every step of the way.
The expanded partnership is available at SSM Health hospitals that deliver babies. You can find more information about how to get involved at ksdk.com/showme.